The disinvestment in CAMHS over several years has created a crisis situation, and we're seeing waiting lists across the country getting very long, and which is making children and young people even iller than ever before. And we're now seeing a crisis in the Tier 4 services, which is when services for inpatient care. So we really need to see the commissioners investing earlier on so that children and young people don't become so severely ill.
Andrew, you're at the sharp end. How's it impacting the work you do with young people who need looking after?
Yes, it's very tough. We found things getting more difficult as funding has changed. One of the really hard things for us as practitioners is not being able to see the people that we would like to see, that we know we can help and we can make a difference for. And that's frustrating for us. It's worrying for young people and families. It's also frustrating for other services around us who want to see people and provide some help. So it's very tough.
We're still in an age of austerity. We had a budget of cuts just last week. Do you think, obviously we need more money in this, and we heard one of the people in that report say there, but do you think the money should be better, more wisely spent, perhaps in prevention rather than putting out fires?
I think it's absolutely true, and the new government policy around the Future in Mind report, which comes from the Mental Health Task Force, is saying that health money must work with other people locally, both with schools but also with social care, so with children's services, so that we have one system of care. We don't have a piecemeal approach where often one department doesn't know what another department is delivering.
Yeah, Andrew, I mean, imagine if a parent has a child or a teenager who does have mental health problems and they're not picked up there, they're going to be picked up at school. Are you having schools come to you, or is there a bit of a sticking point there with them providing information on children with problems?
Schools are common referrers, so they're often working with young people. So it's not really a problem getting information from schools. They often find themselves struggling to know what to do, sometimes holding on, thinking there aren't the services around. So with greater investment, we'd like to support schools much more, work closely with them.
Sarah, what about that other safety net in the form of the GP? Are they geared up for this?
Well, it's an interesting question. I think GPs often find it difficult as well. They find it difficult to refer to CAMHS, as the Children and Adolescent Mental Health Services, because there are long waiting lists, and so they don't know where else to send those young people. They also may not be very confident about what the problems are that they are seeing in front of them, and so also need training, both in terms of talking to teenagers and young people so they can find out what the problems are, and then also what there is locally where they can refer them.
The government has said it's going to follow recommendations to put more money into the NHS during the course of this next Parliament until 2020. It's also talked about its desire to conquer dementia, Andrew. Finally, does it need to take all mental health issues across all ages more seriously? Absolutely.
Certainly working in the field of child and adolescent mental health, we've often felt like the poor cousin of the poor cousin. Hospital sites tend to attract greater attention from commissioners. So as Sarah's talking about the task force report, some big promises, big changes for children's mental health. We really need to make sure that things are followed through and that the money doesn't just fill the gaps that have been accumulating over the last few years. We need to make sure it's targeted for children's mental health and it stays there rather than just whittles away.